my name is Justine Ginsberg and I'll be your host for Health Matters, a news show that's produced by the Farmington Valley Health District to provide relevant and up-to-date important health-related information to you, the viewing public. Public health works to protect, promote health in our communities where people live, work and play. While doctors treat us while we're sick, public health works hard to try to prevent illness and injury in the first place, as well as promote wellness in the communities we serve by encouraging healthy behaviours. Health Matters will allow us to share with you all the work that your local health department does and answer many of the common questions and concerns that you might have. Public health is an invisible discipline. When we're doing our job well, you actually don't see us. I'd like to welcome today Jennifer Katanas, the Health Director of the Farmington Valley Health District, to talk with us so that we can learn the variety of services that are provided to you by your local health department. Welcome, Jennifer.
Thank you very much, Justine. It's a pleasure to be here.
So can you start by telling us a little bit about what the Farmington Valley Health District is?
Sure. So the Farmington Valley Health District is the local health department for the 10 towns in the Farmington Valley. In state law, every town is required to have a public health department. We just happen to be a district that serves multiple towns. We serve a population of 110,000, and we do the variety of programs that you just spoke to, and our primary charge is really ensuring the health of the public in our communities is safe and protected from a variety of public health threats. Because we're a health district, we're governed by a board of directors, so we are a governmental entity, but we are governed by a board of directors that is comprised of representatives from each of the 10 towns, and we are funded by a combination of state funding that's provided at a per capita rate. The municipalities that are part of our district also contribute to our revenues, as well as fees for the different permits that we issue, as well as grant revenue.
Right, well actually it's a great little segue into talking about permits, because I'm sure that the viewing public knows the public health department most for the work that we do in restaurants with inspections. So can you tell us a little bit about that work and why it's so important?
Absolutely. So as you pointed out, most people do understand the Farmington Valley Health District for our regulatory functions, and a big part of that is restaurant inspections. We permit over 600 establishments.
Wow.
They range from your coffee shops and ice cream houses to more comprehensive restaurants, but essentially anywhere food is prepared and served to the public is regulated by us. We have a cadre of food inspectors that are out in the establishments regularly, looking to ensure that the way in which food is prepared, handled, stored, etc., is done in a way that is protective of the public. Unfortunately, most people don't realize that food poisoning is still an issue in our country, and unfortunately, for people that are potentially vulnerable, children in particular, or people with pre-existing conditions, food poisoning can even be life-threatening. So it's really important that we get out and work with our establishments to ensure that food is prepared, handled, and served in a safe way.
Wow, so when the food inspectors go into the establishments, what are they actually looking for?
Sure. So some of the leading causes of foodborne illness are, one, temperatures. Foods that are not prepared to a high enough temperature. So almost all meats, proteins come into a food establishment with some type of bacteria. It's the cooking process that kills that. So if foods are not cooked to a proper temperature, you don't get the kill off of that bacteria, so people may be exposed. Another leading cause of foodborne illness is cross-contamination. So in restaurants, you have what are called ready-to-eat foods, foods like salads, where there is no cooking process. So if you contaminate between like a raw product, a meat or something like that, with a ready-to-eat food, you run the risk of introducing that bacteria into the food that people will be consuming. And lastly, hand washing and hand hygiene and inappropriate use of gloves among those that are preparing food. So we look at what we call critical risk factors, which are some of the things that I mentioned, and then just general sanitation, cleanliness, et cetera, of the establishment.
Wow, so once our food inspectors have gone in and they've performed these checks and balances, is the establishment then issued a permit, or is it rated in some way? How does the general public know that we've been there and where the establishment sits in a rating scale?
Right. That's a great question, and for quite some time the Farmington Valley Health District has had a rating system, which is a mechanism that we feel allows the public to really be a good consumer and understand what the historical restaurant inspections have shown for that establishment. An establishment is required by our regulations to post a rating in a conspicuous location. So if you go into a restaurant and don't see that rating, please make sure you ask to see it. You can also see all of the ratings for food establishments on the FVHD website at www.fvhd.org.
Wow, so the public can actually access that at any time from their own living room?
Yes, they can.
Wow, so the other thing, I suppose, because it's summertime and, you know, we're out and about, you know, finally we've shaken winter off, there's all of these amazing public events, and there's fairs and opportunities for the public to congregate, and often people sell food from vending stands. Does the health district play any role in monitoring that?
Yes, this keeps us very busy, as you can imagine, in the spring and summer and fall months. We have many, many town fairs, public events, concerts, etc. Anywhere food is sold and or provided to the general public by a vendor, the Farmington Valley Health Districts license them. We call it a temporary food permit. Prior to the event, we ask our food vendors to describe the menu, what they'll be cooking, how they will be keeping things cool, how they'll be keeping things hot, what types of precautions they're using during serving, etc. And then day of event, the inspectors will go out just to make sure everything is operating as it should.
Wow, so not only does the Farmington Valley permit restaurants and food vendors, do you have any other permitting tasks that you take responsibility for in our communities?
Yes, in addition to the food regulations, we also permit salons and inspect salons. We inspect and license pools that are accessible to the general public, so public pools, and daycare facilities for certain environmental conditions.
Wow, so swimming pools, I mean, again, here we come into summer and people are starting to, you know, take the covers off their pools. What if I have a private pool and I'm concerned perhaps about the water quality or whether or not it's safe to bathe in that? Can I contact the health district for advice?
Absolutely. So we would recommend the same types of things for a public, for a homeowner swimming pool as we do for the public. So when we go to a public pool, first we're looking for all of those safety measures. Do they have access to a phone, a first aid kit, a safety buoy? Are the ladders and all of the safety equipment working and in good condition, etc.? And then of course we're also looking at water chemistry. We really want to make sure that the chlorine levels are at a point regularly and tracked regularly so that they are killing any type of bacteria, because as we know, it's not just little kids that ingest water when we're swimming. So we really want to make sure that the water quality is safe. And that's the same with a homeowner's pool. We want to make sure that they follow all of the same safety precautions, make sure that they have appropriate fencing, etc. We don't regulate those things, but we would certainly be available to a homeowner to provide them with some guidance and suggestions for making sure their swimming pool was safe.
Oh, wonderful. And are there fact sheets available that the public can access for the health district?
Absolutely.
Wonderful.
Yes.
So while we're still talking about water, I know when I moved to America 5 years ago and my husband and I bought a property, I was surprised to find out that not only did I have a septic system, I also had a well. Is that something that the health district monitors, maintains, permits? How does that work?
Yeah, I'm glad that you brought that up. In the Farmington Valley, we still have a large number of private homes that are still served by a private well. And that's a well that is placed on a property that provides the drinking water, bathing water, etc. for a home. We also still have a lot of homes in the Farmington Valley that use what are called on-site sewage disposal systems or septic systems. And it's the Farmington Valley Health District that has sanitarians that approve those systems so that we can ensure that as the dirty water, the septic water, the wastewater from a home enters into the ground, it is entered into an appropriately designed septic system to effectively treat that wastewater and ensure that it's not negatively impacting private well sources or other waterways in the area.
Wow, so we've established that the Farmington Valley Health District permits our restaurants. It does so much in terms of permitting and controlling the water sources in our communities. You mentioned that the Health District is responsible for protecting the public's health. What other things does the department do to ensure that this occurs?
Sure, so we focus a lot, we've just focused a lot on more of the regulatory functions, but the Health District is also responsible for tracking and monitoring the health status of our community and really making sure that we understand what are those major public health issues that are occurring in our community, and then what can we do both as the health department as well as working with our municipalities and our town partners and other community partners, what can we do to prevent those things? So in addition, we do a lot of health education and outreach. We try and design programs that target those things that are creating or presenting the most significant health problems within our community. Obviously, chronic disease and people living with chronic disease is one of the major things that's causing premature illness and death among people living in our communities. Most of the preventive strategies associated with our chronic disease are activities of healthy eating and active living. So anything we can do, whether that be health education, different initiatives, or even policies at the community level that really promote healthy eating and active living are strategies that we work on. In addition, we do have a lot of programs to help people who are living in our communities that do have chronic disease so that quality of life may be improved. So maybe in a future episode we can talk about chronic disease management programs that we have.
Sounds like a fabulous idea. And when I think about chronic diseases, I then think about those diseases that are acute, that kind of come into our world unexpectedly. I know we've just come out of winter and we had a kind of a topsy-turvy flu season this year. Does the Health District play any role in looking at emergent diseases? I know that last year we had Zika and the year before we had Ebola. What does the Health District do in regards to that?
Yeah, so two things, and I'm glad that you brought that up. Another important role that we play is in infectious disease control. So while we've made incredible strides on, for instance, vaccine preventable diseases, we don't see a lot of those types of what we call infectious disease because they can spread from person to person. We don't see a lot of that in our community, but on occasion we do, and it's the health department's responsibility for tracking and monitoring and making sure that the broader population is not exposed so that we don't have an epidemic type of a situation. We also track emerging infections, and as you mentioned, pandemic flu, it is only a matter of time before, unfortunately, our communities see a pandemic. A pandemic is a flu in which we've never been exposed to it, so the general population has no immunity or protective factors against it. And in a situation like that, you have the potential, depending on the severity of the flu strain, for it to really be devastating to a community. And so we track those things, and we have an emergency preparedness plan. So if there is a large outbreak of something or pandemic flu, we have strategies and plans in place to help contain and reduce the spread of that disease. A few years ago, people certainly were made aware of the Ebola scare, and while there were no Ebola cases in Connecticut and there were a very limited number in the United States, and there was no spread of it within the United States, the health department had a very specific role in tracking and monitoring people who were traveling back from the countries that had Ebola outbreaks. Some of the folks that returned to our communities served in capacities in those communities overseas that might have put them at increased risk, like healthcare providers, nurses, Doctors Without Borders. And so we tracked them to ensure that they stayed healthy. They were required to take their temperature and report any types of symptoms to us on a daily basis for the what we call the period of time from when they would be exposed to when they would develop symptoms. And if there was any sign at all of any type of illness, we would have facilitated getting them to the care that they needed without exposing anyone to them along the way. And there were systems and emergency response plans that were developed to help with that.
Wow, so the health district not only is looking after us in the here and the now in terms of inspecting our restaurants and our public facilities, but you really are protecting the public with that much bigger vision of potential outbreaks and potential risk factors. So, recognising that there are multiple public health challenges, what do you see as being some of the biggest ones within our communities?
Sure. Well, one of the things that we know about the populations living in our 10 towns is that they're an aging population. And so with aging comes a whole host of public health related issues. And one of the things that we're concerned about is falling. Falls are preventable, but yet falls are the leading cause of emergency room visits, hospitalizations, and injury among our aging population. So as a health district, we really need to think about ways in which we can work with that aging population in a way that helps support fall prevention. Another major issue that we're seeing, and it's an issue with the aging population, but we're seeing it across the board, is mental health related issues. And certainly the opioid crisis and all the attention that has gotten has certainly increased the conversation and the dialogue and the concern about mental health in general. Historically, health departments, there's really been kind of a separation of physical health from mental health, but I think we're recognizing increasingly that we need to bridge that gap, that many mental health related issues are preventable, that we need to work to destigmatize the conversation around mental health. So we're talking about, mental health and accessing care and services the same way we do a diagnosis of diabetes or breast cancer. So I think that's another challenge that the health department is going to face down the road.
Wow. So public health is very adaptable, obviously, to the emerging trends that are happening within our society. You've touched on mental health and the need for us to really look at the opioid epidemic. What other things are there that you'd like the folks at home to know about the Farmington Valley Health District that perhaps they don't already know?
Yeah. So you touched on one in your opening. I think oftentimes people hear health and they assume medical care. And the health department is different than clinical or medical care. A provider, a physician or a public health nurse or an advanced practice nurse provides one-on-one care to an individual, either to assist in a diagnosis or treatment of their condition. The public health department really supports the health of an entire community and does what it can through health education, policies, some of the things that we've spoken about, to really ensure that we're focusing on disease prevention, hopefully to stem the tide of preventable diagnoses down the road. So I think that's one thing that I really want the general public to know about their health department is we're really focused on prevention. And, there is an old adage, an ounce of prevention is worth a pound of cure. Unfortunately, our investments are reversed. We invest far more in medical care and clinical care than we do prevention, but we really need to place emphasis on the prevention.
Well, from what you've said so far on the program, the local health department does an amazing job with the resources that you have to be able to protect the public from, disease and chronic conditions, etc. So Looking at the successes of the Farmington Valley Health District, what would you say are the successes you're the most proud of?
Sure. So we have some short-term successes that we've just experienced. One, because we work so closely with the regulated community, we just established a Food Safety Advisory Committee, which is comprised of representatives from the food establishments as well as consumers, because we really want, as a department, to understand what we do well, what we could improve on, how can we enhance the ways in which we work with our regulated community, because in the end, we have the same goal, and that's to keep the public healthy and safe. And so we want to continue to work in that regard. We've had some great success with grant writing, and I'm very proud of the fact that we've received a grant to focus specifically on mental health. It happens to target veterans and men in particular. As we know in the public health field, men are far less likely to ask for help, seek help early, and so we're really excited to be working in that regard. And then I think we are a small department, although we serve a large population and 10 towns, and we can't do that work without community partners. So I think one of our greatest successes is really building relationships with community partners that are also touching the lives of individuals and their health. So our senior centers, our community health centers, the nonprofit organizations that work within our community that provide public health related work. So building those partnerships has really been some of our most important successes of late.
And really, just in closing, before we finish with the viewing audience for this segment, what are some of those longer-term goals that you have for the department?
Yes, well, I've been involved in public health for a very long time, and the national, at the national level, we have established, or there's been a move towards accrediting local health departments and state health departments. And I am moving our department in the direction of ultimately being accredited. Accreditation is a way to ensure that we're accountable to the populations that we serve, that we're investing public dollars in the areas that present the most significant risk to our population, and it's a way to ensure that we're continuously improving and moving forward. So accreditation is one of the things I see moving us down the road. And the other is really improving our linkages with the healthcare system. While we are different, while we're not clinical medicine, we need to be working hand in hand to really ensure that that continuum of prevention through diagnosis, through treatment, and then back into community, and how do we continue to support people within our community so they can live the healthiest lives they can.
Wow. Well, Jennifer, thank you so much for spending the time with us here today, and I'm sure from the viewing audience's perspective, you know a lot more about your local health department. I think you'll agree that our local health district provides far more than we ever thought it did. The many facets of public health truly touch the lives and spaces that all of our communities live, work and play in. We're excited to have this opportunity to reach out to you in your homes and to bring local public health to you in an accessible and hopefully entertaining manner. For more information about the Farmington Valley Health District, you can find us online at www.fvhd.org, or you can find us on Facebook at FVHD. We look forward to having you with us again next time for Health Matters. But until then, please remember that your greatest wealth is actually your health. So stay safe, and we'll see you next time.